fracture, cerebral contusion, acute epidural hematoma, acute and chronic subdural hematoma, and normal pressure hydrocephalus. So let's go. So let's start from the basilar skull fracture. So what does it mean? So it means the skull fracture at the base of the skull. So it's a bone fracture in the base of the skull. So let's see the symptoms. So the main symptoms that I remember when it comes to this includes nose and ears. It's a very important thing. So you bleed from nose and ears. Bleed, and then bleed from ears. And also you can see the cerebrospinal fluid leak from your ears and nose. And so we call it cerebrospinal fluid rhinorrhea, cerebrospinal fluid otorrhea. And the other symptoms include raccoon eyes, which means this. Look at this. It looks like the raccoon's eyes. This is caused by the break of the capillaries near your eyeballs. So it's also called periorbital ecchymosis. And there's also the battle sign, which means you can see the bruising over the mastoid process. So where's the mastoid process? So it's right behind the ear. There's a mastoid process. You can feel it yourself on yourself. And in battle sign, you will be able to see the bruises here, just like this color. So you will see the bruises. So it's a sign of the basilar skull fracture. And you'll also be able to see the carotid cavernous fistula. So in order to diagnose this, you will take the CT scan, X-ray, and MRI scan and determine how big the damage is. And the treatment will be based on the severity of the injury and the structures that are injured. And if there is no serious symptoms, then we will consider the conservative treatment. But if there is cerebrospinal fluid leak that doesn't stop, or if you can see the symptoms, then we will do surgery or drainage, so in order to lower the cerebrospinal fluid pressure. And it is said that they will also use antibiotic for prevention, but its use is still unclear. Okay, next one is cerebral contusion. So what does it mean? It means the brain tissue is bruised. So it's the bruise of the brain tissue due to a direct strong blow to the head. So let's imagine you crash into a fixed object like a wall, and then what happens then is that the part directly under the hit, it goes through the croup injury, and the part on the opposite of the area that was hit undergoes the contra-croup injury. So depending on the severity of the injury, you will be able to see cognitive changes, memory challenges, speech difficulty, and attention problems. Next, we are going to talk about acute epidural hematoma and acute subdural hematoma. So let's think from the name. What does it mean? So epi means on or up. The dural means dura mater. So it's the bleeding on the dura mater, outside of the dura mater, while sub means under, so it's under the dura mater. So let's review the structure of the brain. This is the skull of the brain, and this is the brain surface. So between the brain surface and the skull, there are three layers called the meninges. So it includes the dura mater, and then it is the outermost layer in this tree, and then there will be subarachnoid layer in the middle, and then the innermost layer is called the pia mater. So you can just think, it says epidural, then where is it? So it's between the skull and the dura mater. So please see this. Between the skull and the dura mater, if it is there, then we call it epidural hematoma. And if it's between the dura mater and the subarachnoid layer, then we call it subdural hematoma. Okay, next. So this is the summary of the difference between these two. So the epidural hematoma, it's between the skull and the dura mater, as I just said. And the subdural hematoma is between the dura mater and the arachnoid layer. Most of the bleeding in the epidural hematoma comes from middle meningeal artery. Meanwhile, in the subdural hematoma, it's the bridging veins that's bleeding. So you can just remember this B is from this B. So sub, if you hear sub, then just remember it's the bridging veins. And then in the epidural hematoma, there is the lucid interval. It's an important thing, please don't forget. And then in subdural hematoma, there's no lucid interval. So what is this lucid interval that we're talking about? It means there's some time before you lose consciousness. So in case of the middle meningeal artery bleeding, then you will see a lucid interval of around 6 hours, and with other veins or arteries it will take longer. But in subdural hematoma there's no lucid interval, so it means that you will see loss of consciousness immediately after the injury. Okay, next, in CT scan you will see a convex shaped high density area in acute epidural hematoma and a crescent shape in acute subdural hematoma. I will explain why in the next slide. And in epidural hematoma, it usually accompanies skull bone fracture. So we can check that through X-ray if there's skull bone fracture. As for the treatment of these two, so it's the same, and it depends on the severity of the injury and the size of the hematoma. So the treatments include careful monitoring and craniotomy and bar hole. So craniotomy means opening your skull in order to lower the cerebrospinal fluid pressure, intracranial pressure, or take out the hematoma. Or on the other hand, bar hole means making a hole through your skull in order to reduce the intracranial pressure. And in subdural hematoma, if it accompanies brain contusion, then the prognosis is pretty bad. Okay, let's see the CT scan. So this looks like a convex shape, isn't it? So it means it's epidural hematoma. Epidural hematoma is between the skull and the dura mater, and these two are pretty tightly adhering to each other. So the blood, it's very hard for it to spread fast, so it looks like a convex-shaped hematoma. Meanwhile, in the subdural hematoma, it's easier to spread around because it's between the dura mater and the arachnoid. So it looks like a crescent shape. And then the next one is chronic subdural hematoma. So it's chronic subdural hematoma. So from the name, we can know that it will take longer, and subdural means it's between the dura mater and the arachnoid layer, and then hematoma. So chronic means it's longer. It takes longer to show symptoms. So why? Because it's minor. So it's after the minor traumatic brain injury, the blood collects over time, and it will take around 3 weeks to 6 weeks usually, and the longest might be 2 or 3 years. So it shows the symptoms over time really slowly. And the symptoms include headache, nausea, vomiting, hemiplegia, and then losing your consciousness, decreased level of consciousness, difficulty with gait or balance, incontinence, and they all can be seen over time. So it's similar to the symptoms of the intracranial pressure rising up. And in chronic subdural hematoma, the CT findings, the most common, the bleeding from the bridging veins, and the place, everything is similar to the acute version. And the risk factors include older age and long-term alcohol use. Older age, do you know why? Because when you age, your brain shrinks with your age, and then once it shrinks, the bridging veins get weaker, so it's easier to go through injury, it's easier to get damaged. So older age is a risk factor. And then normal pressure hydrocephalus. It means, from the name we can see that it's the normal pressure, and then there's a lot of, well, it's actually not water, or it seems like water head, so like there's a lot of water in your head, but it's actually the cerebrospinal fluid built up in your cerebral ventricles, so that they will dilate, get bigger, it seems bigger, right? But if you measure it from the spinal tap, the cerebrospinal fluid pressure is still the same, or even if it's elevated, it's just a slight elevation. And in normal pressure hydrocephalus and PH, we have 3 classic triads. Okay, the first one is urinary incontinence, and then the second one is dementia. The third one is gait disturbance. So you have to remember this. And in CET or MRI scan, you can see the ventricular enlargement or brain atrophy. And the treatment for NPH is ventriculoperitoneal shunts, as it's the most common treatment. So what does it mean? So we need to understand it from the name. So ventricular means your brain ventricles, and the peritoneal means your peritoneum, which means your stomach, your peritoneal cavity. So it means we will make a shunt from your brain ventricles to the peritoneum so that the cerebrospinal fluid will flow from your brain ventricles to the peritoneal cavity, and your body will reabsorb it back. And so the pressure, so the excess cerebrospinal fluid will be controlled. So that's it. Thank you very much. If you liked this video, please don't forget to hit the subscribe button over there for upcoming contents. Thank you very much for watching my video.